I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore Iowa stories of survival, hope, and inspiration. Today we've brought in a couple of experts to talk about drug-endangered children in Iowa. As the opioid epidemic and alcohol abuse continues, meth makes a resurgence and marijuana use is growing to all-time highs. No pun intended. Iowa faces an impending crisis of more drug-endangered children. We're joined by Jennifer Slater of Blank Children's Hospital and Agent Lee Leiter of the Drug Endangered Children's Program in Iowa to update us on what is happening. Welcome to the show.
Thank you.
Thank you.
Thank you for coming. Jennifer, start out, can you just tell us what a drug-endangered child is?
Sure. Anytime there's a child in a home where a parent or caregiver is using illicit substances or under the influence of some type of substance, we know that there's a harm to that child or a possible risk of harm to that child. So anytime you have children plus drugs, that is what a drug-endangered child is.
And that's primarily illicit drugs?
Primarily, yes.
But it does include some legal drugs that are abused?
Yes, it can be.
Now, from a public safety point of view, Lee, where does that interaction come in? When do you identify a drug-endangered child? Is that a bust? Is it, where do these things happen?
It can be any different way, and it's not only users and abusers of illicits or any drugs, but people that deal. There's a risk and an exposure the children have. People that transport illicit substances, there's a risk and an exposure that the kids have, that there's an element of danger and potential violence, all kinds of things that go along with any aspect of the drug culture.
So any home, any car, any public place, all of them potentially have risks for children.
Correct.
Jennifer, can you tell us a little bit about the program, the DEC program, and how it works?
Yes, the Drug Endangered Children program was started back in the time when meth labs were really popular or prevalent. At that time, there wasn't really a collaboration between the agencies that were working with these children and these people. And so sometimes these kids were missed or left behind. If there was a drug bust, maybe the child would be handed off to a neighbor or relative. Maybe law enforcement would forget to call the Department of Human Services, or maybe the Department of Human Services would forget to call law enforcement when there are concerns of drug use in a home. So there was just a lot of missed opportunities of recognizing and identifying some of these children. So the Drug Endangered Children program is a collaboration of many agencies and professionals that work with these children, trying to work together to make sure that we're identifying these children, making sure that they're in safe environments, and then providing the resources that they may need.
And what ages do most of these children fall into?
So it may be the agencies that, including law enforcement, Department of Human Services, it could be the attorneys that are working with these children, the medical professionals that may see these children. We also include other people that may see these kids, especially like teachers, daycare providers, people that are spending a lot of time with children that may know best what kind of possible risk these children may be facing.
And how old are these kids generally?
Any age. It can be anywhere from newborns up until 18.
So a lot of them can be just basically completely innocent. They have no way to avoid it. They don't know the risks. They just happen to be close to these things.
Absolutely. They can be innocent bystanders in these cases.
Now that sounds innocuous, but what are some of the symptoms?
So a lot of times when these children come from these homes, they may have some kind of signs of neglect just because their needs may not have been met in the home. So some of the younger children may have developmental delays, some behavior problems. Maybe they have not been to a medical provider in a long time. They haven't been to a dentist. They haven't had their immunizations. So simple things that most parents are doing just on a routine basis. For these children, those needs may not be met.
They don't get done. So Lee, when you encounter a situation where you meet the kids, I mean, you're on a crime scene or whatever it is.
Yes, sir.
What's it feel like? I mean, do these kids, do they look like normal, healthy kids, or does it seem like they're endangered? I mean, is it evidence there when you look at it that there's something wrong?
There's sometimes obvious evidence, but even the parents that are caught in the drug culture, they don't I don't believe that they wake up in the morning and intend to abuse or neglect their children. Their addiction is driving their behavior, making poor choices. These children love their families. We try and, as law enforcement as a whole, try and not be an enemy to these children and try and interact with them, make it positive. We don't want to rip these children away from their parents, but accountability is important in the treatment of the substance abuse disorders. And there's new things that we learn every day, new programs, new interactions, new team members that we need to identify. If the parents, through their court proceedings, if they have law enforcement interaction, well, maybe individualized treatment isn't best. Maybe family treatment would be best for that family to keep them together. Again, the children love their parents, and we try to make it as minimize the trauma to the child at the scenes that we deal with.
And find help to keep families together.
Yes.
Well, that's a great point. We'll come back after the break, continue. When we come back, we'll talk with Jennifer and Lee about some of the challenges faced by public safety and health professionals when drugs come into contact with children. See you after the break. You don't want to miss this.
1 gig is the future, and Mediacom provides the most complete coverage. America's first 100% 1 gig technology network, offering gigabit speeds in every market we serve. In town or out of town, big city or rural, you've got access to the fastest. We know the future will demand more speed, so we've built a network to give you the most. 1,500 communities, 2.7 million homes, 100% 1 gig.
After the rain stops and the wind dies down, when the fire's gone out and the dust settles, we rise up together and become a force of nature all our own. As part of this community, Mediacom stands with you, doing everything we can not only to restore your service, but to help provide emergency communication access, assist relief efforts, and support our neighbors.
Mediacom Internet customers, increase your speed and save on faster speeds up to 1 gig. If you have more users and more devices competing for more of your bandwidth, a speed boost on our fiber-rich network can easily accelerate performance all over your house. Faster speed, faster Wi-Fi, faster everything. Don't wait. Boost your speed to the next level of super fast internet for as low as $10 more a month for 1 year. Call 844-EXTREME5.
Welcome back to Surviving Bad. We're talking about drugs and children, a potentially dangerous combination when literally babies are exposed to the risks. Welcome back. You know, you made an interesting point during the break that we can't arrest ourselves out of the problem. And especially since I think some of the problem might be opioid use that's not necessarily quote unquote illegal. Other recreational drug uses where the question of legality is tough. You know, what is the solution to the problem? If we just can't come in with brute force, so to speak, what do you think we should be doing?
We know that sometimes when children are living in these environments, there can be trauma that they experience from their experiences in those homes. So our hope is that we're going to work with those children to help minimize some of the effects of that trauma that they have already faced. And the hope is that that will minimize the chance that they will go on and continue to use substances as they get older. We know that children that have a lot of trauma in their childhood have an increased risk of using substances as adults. So part of the program is just to provide resources to children to try to break that cycle.
Now, in providing those resources too, I've noticed that you really do a lot of outreach in communities, both in terms of education and trying to give them more resources to help these kids. How does that work? I see you give like packages of emergency materials for different situations like that to groups and communities. I don't know anything about it, so I'm just curious what other stuff you do.
We do quite a bit of education with the professionals that are working with these children, like I said, with law enforcement, DHS, those that may be responding at times of crisis, but also with teachers, daycare providers, mental health therapists that may be seeing these children on a regular basis and helping them to recognize some of the signs that they may see in these children so that we can hopefully identify these kids and get whatever resources in place as soon as possible.
And what do you think we could do about getting to this problem before arrests happen?
Well, prevention also is part of this whole package, and it's drawing all these professionals together to streamline services so there's no fragmentation between law enforcement and what they're doing and DHS and the medical professionals and what they're doing to streamline those services, but also identify for prevention and treatment before we get to those emergency incidents where we've entered a home, or we've done a traffic stop, or we've found parents that are unconscious because they've recently overdosed and the kiddos are in the back seat. We don't want those incidents. The prevention needs to be a big component of it. And the whole idea behind the Drug Endangered Children program is breaking that cycle of abuse. And the drug enforcement that has occurred over the last 25, 30 years has been significant. We spend a lot of law enforcement resources to it, but if you grow up in a home where mom has a substance abuse disorder or dad has a substance abuse disorder, that puts you at risk, and you observe those behaviors, and those behaviors become normal and part of everyday life. So those are the kiddos we need to identify and try and have some type of intervention with.
What do people need to know that maybe don't do drugs and don't sell drugs, but they live in communities where things could be happening, in terms of signs from their kids' friends or stuff like that, to know if there's some problems in the community?
There may be behaviors in those children such as not wanting to go home, maybe seeking food all the time, or just changes of behavior that you may see in the child. Maybe they start acting out all of a sudden, or they start to regress all of a sudden. So there may be different things like that that could be indicators of some problems in the home.
So you start out really wanting to help the children and also get that family reunited. That doesn't always sound like, it doesn't sound to me like that's a short process. This could conceivably take some time with all the partnerships that you have involved with taking care of the kids and then the public safety part. When you get into a drug-endangered children's family, let's say, in a home, and you identify that these kids are affected, are both couples usually engaged in the drug industry and business, or users, or is there sometimes one or the other, or a child? I mean, is there some kind of a formula that we need to know that maybe looks more risky than others?
I can't think that there is. Even social or economic status doesn't seem to matter. It's someone with a substance abuse problem that would become the norm in that household.
So you see everybody. It doesn't, socioeconomic status, nothing limits that potential risk for kids.
No, sir.
Now, are you seeing a growth in the need for the program? I mean, does it look like there's many? Can you service all the kids that are out there, or do we need more resources to go to you to help things out?
I feel like the number of children being affected has not decreased, and that may be because we're doing a better job of identifying them, but it is difficult to keep up with the resources needed for these kids.
We'll come back and talk about that. When we do come back from the break, we'll take a closer look at the trends, potential solutions, and what's being done to help build the capacity of this program to protect the most innocent of young Iowans. See you after the break.
One gig is the future, and Mediacom provides the most complete coverage. America's first 100% 1 gig technology network, offering gigabit speeds in every market we serve. In town or out of town, big city or rural, you've got access to the fastest. We know the future will demand more speed, so we've built a network to give you the most. 1,500 communities, 2.7 million homes, 100% 1 gig.
After the rain stops and and the wind dies down, when the fire's gone out and the dust settles, we rise up together and become a force of nature all our own. As part of this community, Mediacom stands with you, doing everything we can not only to restore your service, but to help provide emergency communication access, assist relief efforts, and support our neighbors.
Mediacom Internet customers, increase your speed and save on faster speeds up to 1 gig. If you have more users and more devices competing for more of your bandwidth, a speed boost on our fiber-rich network can easily accelerate performance all over your house. Faster speed, faster Wi-Fi, faster everything. Don't wait. Boost your speed to the next level of super fast internet for as low as $10 more a month for 1 year. Call 844-EXTREME-5.
Welcome back. We're talking with Jennifer and Lee about a dangerous combination, drugs and children, and what can be done to protect them. Welcome back. It takes a lot of people when you deal with the kids in a community. How hard is it to build these partnerships, and how big is the network? What are we people encountering here? Because for me, it's sort of like a mystery. I know that kids are affected, and we know that public safety encounters kids that are abused all the time, and we think of them as being really innocent because they essentially are. What in a community, if somebody had to look and say what the resources are, what does it look like? Could it be a church group? Could it be a local prevention agency? Would it be the local hospital, the doctor's office, the county sheriff? Where do we find access to these resources in your community?
There seems to be champions in every community, and it doesn't matter who it is, whether it is the county sheriff or if it's a faith-based organization or even a veterans organization. It's identifying the resources that are available in that community and the awareness. Because everybody wants the best outcome for the children. It's streamlining those services and make sure that there's some coordination.
And I know one of the aspects of your program is that you really make sure they get a comprehensive view. So we take into account the mental health, the physical health, all the pathways to getting that family back together and healthy. How many, do we have coverage in 50% of Iowa counties, 90%, 20%? I mean, is this a program that's really burgeoning, or do we really need to get it out there more?
As far as formal drug endangered children programs, there are not very many throughout the state of Iowa. We're working on increasing that and providing education to professionals out in the communities to increase that, but you don't have to have a formalized program in order to be able to provide services for these kids. So as long as people are willing to work together, they can still help to identify these kids and to help give them the resources they need.
And you work with children in a clinical setting.
Mm-hmm.
Is there a reason, and I think there would be, for hope if we can get them help as soon as possible?
Absolutely, yeah. I think the key is identifying them early and getting them resources right away, getting them whatever help they may need, and kids are resilient. So I think once you identify that and help them to deal with some of the things that they've been through and help them to make their families healthy, I think these kids can do really well.
So if somebody knows an affected person, whether they've been engaged with law enforcement or something else, who might they contact? Where would they go to find out a way to get help for the kids? Would it be to your website?
Yes, we have an Iowa DAC program, and that's through the ODCP website in Iowa. And there's also a national program, the National DAC organization, and they have their own website. I believe it's nationaldac.org. So there are websites available, but they can contact law enforcement or DHS, or their medical professionals in their community are usually good resources as well.
And it's probably safe to say that the organizations you work for are strong partners in building some of these relationships throughout the entire state.
Yes.
Tell me a little bit about what you do. I know you go out and do outreach to different communities and you try and stimulate some of this growth. What are some of the things you encounter out there?
Well, we've had as many as 19 formal programs in the state. Unfortunately, they were champion-led. I spoke about that a minute ago. People retire, people promote. move on to different professions. So what we want to see as an organization is that the community adopts the philosophy and maintains that philosophy and use the resources that they have the best they can. Jennifer and I are both trainers for the national organization that she spoke about with National DEC. There's science-based research out there. When this program started, it was a response to meth labs, and it should have been a response to all drug-affected children. So when the meth labs in Iowa decreased because of numerous decisions that were made, including pseudoephedrine legislation, I think the public perception was that the drug-endangered children problem was gone because meth labs were on the decrease. And it's not about meth labs, it's not about meth, it's just about those poor decisions by caretakers that are under the influence of a drug.
And how much does the concept of stigma affect the ability to get this message out? I mean, is there sort of a have and have-nots attitude that if people have this problem, there's sort of a stigma attached to them and the community may have a difficult time embracing it? Do you run into that in trying to build some of these resources?
I think there is somewhat of a stigma. I think that sometimes prohibits parents from seeking help because of the stigma that goes along with substance abuse disorders. And unfortunately, there are some professionals out there that do have a view on substance abusing parents. So I do think that sometimes can be a barrier. Part of our goal is to try to overcome that and make sure that.
And is there a role for potentially some diversion out in the public safety world to get people treatment and care before they become criminalized?
Absolutely. The drug courts in Iowa have done an excellent job. There's all kinds of programs that really partner with us. There's a Parents as Partners, grandparents program. There's some great programs out there that we do work with and individual communities work with. There's coalitions, nonprofit coalitions all the way across the state, and the basic philosophies are there. They just may not call it the Drug Endangered Children Program, but it's working.
All right. When we come back, I'd like to get some of your advice for parents in dealing with some of these issues. We love bringing our guests back to share advice because it can help keep your family safe, and you don't want to miss this. See you after the break. I'll talk this.
1 gig is the future, and Mediacom provides the most complete coverage. America's first 100% 1 gig technology network, offering gigabit speeds in every market we serve. In town or out of town, big city or rural, you've got access to the fastest. We know the future will demand more speed, so we've built a network to give you the most. 1,500 communities, 2.7 million homes, 100% 1 gig.
After the rain stops and the wind dies down, when the fire's gone out and the dust settles, we rise up together and become a force of nature all our own. As part of this community, Mediacom stands with you, doing everything we can not only to restore your service, but to help provide emergency communication access, assist relief efforts, and support our neighbors.
Mediacom Internet customers, increase your speed and save on faster speeds up to 1 gig. If you have more users and more devices competing for more of your bandwidth, a speed boost on our fiber-rich network can easily accelerate performance all over your house. Faster speed, faster Wi-Fi, faster everything. Don't wait. Boost your speed to the next level of super fast internet for as low as $10 more a month for 1 year. Call 844-EXTREME-5. With home phone service from Extreme, you get a long list of features for less than $5 a month. You get unlimited nationwide calling in the U.S. and Canada. Our convenient caller ID on TV feature, call waiting, 3-way calling, and 11 more features. It's the perfect backup to your cell phone, and switching is easy. You can even keep your phone number. Get home phone service from Extreme, powered by Mediacom, for less than $5 a month for 1 year. Call 844-EXTREME-5.
Welcome back to Surviving Bad. We're talking about protecting innocent children from dangerous exposure to drugs and how Iowans, you, can get the help you need. Now it's a great time to talk about, as adults, as parents, as family members, what kind of advice would you give to people when they're facing any challenges in their families or in their groups about drugs and children? Let's start. You're dad. What's up? What would you tell people to be most careful about?
I wouldn't say necessarily be careful. Be a hand up. Everybody can think of one person that you had a 5-minute interaction with, whether it was a teacher or a doctor or whoever, a clerk in a store, that you can make a difference with somebody. So be that hand up. Talk with these children. They'll tell you a lot, and they are resilient. We always end our trainings with, this isn't doom and gloom, because the program's designed to have a good outcome, not a bad outcome. So we just try and not be negative, I guess, at the end.
That's a great point. And Jennifer, you get to work with these kids face to face. What do you like to instill in them when you're working with them?
Just that they are resilient and that they're strong kids and they have a lot of positive characteristics for themselves, and just to focus on the good, that they still have a lot of potential and they can grow up to be really happy, healthy people in the end.
Do you see them with hope in the end?
Absolutely, yes.
That's fantastic. So when kids are resilient, do they also help the parents get back in touch with the family? Is that something that helps lead the parents out of the problems they've had with drugs and alcohol?
Yes, a lot of times the kids are kind of the driving force for the parents. You know, they want to be able to have their families together, so that love and those bonds are really important for both the children and the parents.
And that's an excellent thing for DEC to invest in. Thank you very much for sharing your ideas today.
Thanks for having us.
Thank you.
And thank you for joining us on Surviving Bad. Keep your eye on Mediacom MC22 for our next episode, where we explore Iowa stories of survival, hope, and inspiration. On Surviving Bad, only on Mediacom MC22, your local programming leader.
Or someone you care about are looking for help with treatment or recovery, there is help out there. Please visit these sites.